Hello, my name is Elizabeth Berry. I'm a dermatologist at Oregon Health and Science University. I want to start by thanking the International Dermoscopy Society and La Roche-Posay for the opportunity to present this webcast on the dermoscopic features of non-pigmented basal cell carcinoma. The most important features of non-pigmented basal cell carcinomas fall into one of three categories. The first is vessel morphology. The second, presence of ulceration. And the third are shiny white structures, including patches, blotches, and strands. I'll also be covering important dermoscopic mimics for each of these categories. Arborizing telangiectages are probably the most recognizable feature of basal cell carcinomas. Normal blood vessels in the skin are present in the dermis and subcutaneous tissue and appear blurry on dermoscopy. However, the vessels in BCCs are present much higher in the skin and are crisp and sharply focused. They start as larger caliber vessels and then subsequently branch into smaller and smaller blood vessels, and they really resemble a tree, thus the term arborizing. As I noted before, the arborizing telangiectages are larger caliber vessels. This is really important for differentiating them from the other smaller vessels of things like amelanotic melanoma. These vessels will also tend to cross the midline, as you can see on the left here and on the right panel here. I think it's also important to see arborizing telangiectages in the context of sun-damaged skin. So in sun-damaged skin, you can get branching, blurry telangiectages, but remember these vessels are in their normal place, and that's what makes them blurry. Whereas the arborizing telangiectages, again, are those vessels higher up in the skin that have grown and coursed throughout the tumor. And so you can see the blurry background vessels in this person's sun-damaged skin compared to the arborizing telangiectages. And also in the right pane here, you can look at the individual's background sun-damaged telangiectatic skin, whereas these arborizing telangiectages are sharply focused and crisp. Short, fine telangiectages are the second vessel pattern seen in basal cell carcinomas and are usually indicative of a more superficial BCC. These telangiectages are less dramatic than their arborizing counterparts. They are smaller in caliber and they're shorter than the arborizing telangiectages. They come in sort of linear or straight, more straight vessels, or serpentine or curved vessels. So you can see this is a serpentine vessel here. Here's a more linear vessel here, but they're much more subtle. Here we see more of these subtle, short, fine telangiectages. On the left here, you see these short, sharply focused telangiectages, accompanied by a little bit of scale, which I feel like is very helpful in identifying superficial basal cell carcinomas. And in the pane here, you see more of these short, more subtle telangiectages. Now, other tumor types have sharply focused vessels as well, so we'll spend a couple of slides going through visual mimics. At first glance, your eye may be drawn to these sharply focused, almost branching vessels over here. But this is actually an inflamed seborrheic keratosis, and inflamed seborrheic keratoses can generate some really bizarre appearing crisply focused vessels. But if you take a step back, you can see that there are several hairpin vessels that sort of loop, and they have a white halo around them, which is a hallmark of a seborrheic keratosis. And then you also see these comedone-like structures and a well-defined border. The crown vessels in sebaceous hyperplasia can also appear to branch, but these vessels hug the border, they are blurry, and they don't cross the midline. And then you can see these yellow globular structures within the center. The polymorphous vessels of amelanotic and hypomelanotic melanomas can also be sharply focused, but you can differentiate these from the vessels in BCCs because they're smaller. They tend to be all one caliber, and often they'll be sort of in the background of other melanoma-specific red flags. So here you can see these structureless, hyperpigmented areas, this atypical network, and this background reddish pink blush. Although the vessel here is sharply focused, this is actually a corkscrew vessel, which is a variant of one of the polymorphous vessels of amelanotic and hypomelanotic melanoma, and often indicates a melanoma metastasis. The third key dermoscopic feature of BCCs is ulceration or erosion. The tumor tissue in BCCs is naturally friable, and so any small trauma to these nodules can cause a little bit of small bleeding that's detectable dermoscopically. Even the action of wiping the lesion with an alcohol swab can cause a little bit of bleeding. This is a challenging lesion, but the presence of focal small ulceration, as well as these shiny white lines that we'll discuss in a minute, are very helpful in differentiating this from a hypomelanotic melanoma. Scalp BCCs can be particularly hard to diagnose, but the collection of erosions, in addition to some sharply focused branching vessels in this, help with the diagnosis of this lesion. BCCs are obviously not the only tumor that can ulcerate, so here are a few visual mimics. This otherwise banal-appearing ulcerated pink-white papule actually ended up being a traumatized melanoma metastasis. And you can see here that there are no other features that lead you toward the diagnosis of a basal cell. Squamous cell carcinomas will also exhibit some ulceration and some serosanguinous crust. But you can see in this lesion, you've got a lot of these kind of yellow scales that are indicative of an SCC. The final dermoscopic hallmark of BCCs are shiny white structures, including patches, blotches, and strands. In addition to some short fine telangiectages in this lesion, you'll also see these shiny white blotches. They're termed shiny because when you take your dermatoscope on its polarized setting and rotate it 90 degrees, these structures will shine back at you. I wanted to revisit this BCC because it has excellent examples of the shiny white patches, blotches, and then these little linear strands. So these, accompanied by these little focal ulcerations, help you move away from something that might be a hypomelanotic melanoma firmly into a basal cell carcinoma. This is another example of a superficial BCC that's got some scale, some short fine telangiectages, and then a few of these shiny white blotches and strands. There is one important mimic of the shiny white structures seen in BCCs. Crystalline structures, also known as orthogonal white lines, are the melanocytic counterpart to shiny white structures in BCCs. However, these structures in melanomas tend to be finer and more well-defined. You can see in this lesion, you've got these orthogonal white lines arranged. If you moved your dermatoscope, they'd shine back at you. And they're in the background of this tan homogeneous pigment and also some of this milky pink areas. This is another melanoma with orthogonal white lines or crystalline structures. You can see these kind of fine crystalline structures arranged kind of at almost 90-degree angles. But again, in a background, this is an atypical pigment network, and there's some milky pink areas. Today we've covered the dermoscopic hallmarks of BCCs, including vessel patterns such as arborizing telangiectages and the short fine telangiectages that are characteristic of superficial BCCs. We also looked at ulceration and erosion, and shiny white patches, blotches, and strands. And just a reminder to always beware of mimics. Thank you again for listening, and thanks to the International Dermoscopy Society and La Roche-Posay for making these webcasts possible.